Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and I'm really delighted today to have as my guest Dr. Sandra Musial. Dr. Musial is a medical physician, board certified in pediatrics and obesity medicine, really spending a lot of her life in plant-based healthcare, and we're going to talk about her incredible program, Plant-Based Docs, and the programs that they offer, Plant Docs. And and she also teaches as a faculty member, residents and medical students at the med school at Brown. And I know that's part of your professional life. So welcome. It's so nice to meet you. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world, championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thanks for having me.
I have to tell you that I found my way to you by a mutual friend, our good friend Kim Anderson, who runs Plant City in Providence. Kim has been a patient and a friend for many, many years. And, she said, you've got to meet Dr. Musial. She's doing some amazing thing. I said, I'd love to. So that's what we're doing. So I'm so happy you're here.
Oh, that's a great referral. Thank you.
Yeah. When people get involved in this lifestyle without even being physicians, there are many things that provoke that. There can be health issues. There can be concerns about animal health or safety and environmental concerns. But I noticed with you, your undergraduate degree was in nutritional science. So you have interest in nutrition going way back into your teenage and college years. So talk about how you segue into that passion and how that played into where you went next.
Yeah, I think it's really in my genes. I was just born into a family. My dad grew all our vegetables in the backyard. He was an engineer, but everyone I knew had a backyard garden. And my background is Ukrainian. And when I visited Ukraine, I realized I had this big aha moment because everyone over there grows vegetables in their backyard. They have to. It's more like sustenance gardening. And it all just made sense because I've had this lifelong love of growing things and gardening. And as a child, I was surrounded by that, nice, healthy vegetables and salads every day for dinner. But my father's brother died of a heart attack when I was in high school or maybe middle school. And my father started reading and he subscribed to a magazine called Prevention Magazine. Mm-hmm. And he just started making changes in the house. We stopped eating red meat. We stopped frying chicken. We got off the, full fat milk. There were things that he read about that he brought home, and it had a big influence on me. And that really, I think that was a big part of why I ended up studying nutrition in college.
And then going from there, though, what was the provocation to go into medicine? Let's talk about that's the next step. That's a big step. So, and then talk about how where your mindset was as you entered med school and how maybe that evolved through the course of that time there.
My dad was very practical. So in high school, when we were trying to decide, what are you going to major in? Where are you going to go? He had me open the classified ads in the newspaper, which was how everyone found a job back then. Mm-hmm. And he asked me to circle any job that looked like something I would be interested in. And I circled all the medical jobs, nursing and tech jobs. And it was really helpful. It made me realize I really was drawn to taking care of people in medicine. I was fascinated why aspirin would make my headache go away. And then this connection between food and health. I entered college thinking, maybe I'll be a nutritionist. Right. That was kind of the plan. But in the back of my mind, I was thinking nursing because I didn't have a lot of female professional role models in my life. So being a doctor seemed to be more of a male-dominated field. But then in college, I, broadened my horizon and I realized this was something that might be possible for me. And that's how that kind of unfolded. And after I graduated with my nutrition degree, I went interviewing and looking at jobs, and I really didn't like any of the jobs for
Right.
nutritionists. I realized what I didn't want to do. I wanted to be the person writing the prescription for the diet, not the one figuring out how to fill it in the hospital.
Right.
So that's what led me down the path to medical school. I ended up doing a couple years of molecular biology research in Boston, and I met a doctor there who was a woman who had 4 children. She did research, she saw patients, and it was the first time I had met someone that seemed like a good role model for me. And it really kind of catapulted me into the medical field. And I just decided to go to medical school.
And at that point, you were still pretty much looking at the conventional approach to medicine at that point. It had not shifted yet. Where did the shift occur for you in terms of going into more of a plant exclusive mindset or plant-based approach and looking at how that could impact health?
Yeah, I mean, there wasn't whole food plant-based kind of definition back then. There wasn't, a tract for someone like me, at
Right.
least not one that I found. So I just felt I just went down the traditional path. I remember back then I was interested in like Eastern medicine and somehow melding the
Right.
East and the West. But I didn't know how to do that. I didn't
Right.
have any way to do that. So I just did the conventional route while, knowing that nutrition was important to me. I didn't learn a heck of a lot of nutrition in medical school, but I did fall in love with the pediatric population and then decided this is something I could definitely spend my whole life doing, is taking care of kids. And
Right.
I ended up doing that and becoming a lactation consultant, which went along with my kind of passion for nutrition. I felt like whatever I could do to help moms to be
Right.
successful breastfeeders. And then it was really, I was in private practice and there was a mom who came in and she said, "Have you read the China study?" And I had no idea what she was talking about. But I ended up getting that book. She said her doctor told her to get it and that she shouldn't be giving her children cow's milk. And I didn't know. I was like,
You were
this,
like, what?
yeah, I'm like,
What?
this sounds like just bad advice, right? But it came up another time. I met a woman in my weaving class who had terrible psoriasis and
Right.
couldn't weave. And she actually went to this, I'm in Rhode Island, it's very small. So she went to the same doctor that this other patient was telling me about. And in the weaving class, she was talking about the China study. And each week, when we would go back to weaving, her hands would get clearer and clearer. And they were just, her psoriasis was disappearing just by going on a whole food plant based diet with
Right.
no medications. And that was the first time I saw someone reverse their disease after reading the China study. So I went out and bought it, and it really changed my life. That was my gateway drug to the whole food plant
I
based
got it.
world.
Have you ever met Dr. Campbell?
I have.
Yeah, Colin's a very good friend, and it's amazing how many people he's influenced
Oh,
through the years with his work. I mean, it's just mind blowing to see that. And I've even asked him. I said, "You must feel so amazed at all the millions of people you have influenced with the work that you've done." And he's just such a gracious guy, anyway. So, but yeah, so that was interesting. So that was your turn on. Let me ask you a question. I know that you, because you are a professor too, you teach students, you teach residents. How in your work do you move medicine forward, kind of, in terms of this consciousness of, the impact, the power of plant-based living and the ability to alter these incredible chronic diseases? Is that difficult to weave into the teaching that you do, or how do you integrate that?
yeah, it's very hard.
Right.
In fact, I no longer do that.
Okay.
So after private practice, I went into this academic position at Brown teaching the medical students and the residents. And I was a professor there for 11 years.
Okay.
And it was very challenging because the American Academy of Pediatrics was still pushing milk. And I felt like I was an outlier. There were no other faculty members that were educated in whole food plant-based nutrition. And I did find it challenging. But one way I navigated was after getting board certified in obesity medicine, I opened a obesity clinic for children with Dr. Corcoran. And I found like if I just focused more on, instead of talking about meat, I tried to just focus more on eating more fruits and vegetables, cutting out the sugary beverages, eating more whole grains over the refined grains,
Hmm.
and offering plant-based alternatives. A lot of the patients were Hispanic and already had legumes as like a culturally normal food that was part of their diet, but they also love to add in meat. And so I would just focus on, you don't need to add in meat. It would be better to focus on the rice and beans and add in a vegetable. So instead of saying go vegan or, that wasn't going to be accepted.
That wasn't going to fly, so you made it fly however you could, which was great. I mean, you made a big dent in all of that. And look, the obesity story has always been a big piece for me too. It's about $170 billion that it demands in our healthcare dollars, and 14 billion of that is pediatric obesity. So have you seen, through what you've done there, some impact to shift that a little bit? Talk about that shift, if you've seen anything at all with the work that you've done, because you've been there a long time doing that.
Yeah, I was there 11 years, and we did a research project while I was there, preventing the introduction of sugary beverages and juice in infants. We started really early. I started a vegetable garden at Hasbro that's still going strong, so the children could see how vegetables grow. And it was called the Hasbro Rainbow Garden. Each bed was a different color of the rainbow.
Beautiful.
As far as the impact on pediatric obesity, I think I don't have an answer to that. I didn't see a big impact. It's just one patient at a time.
Right.
The way the clinic was set up, I don't think is the best way to go about addressing it. And I don't feel like my voice was being heard. So I chose to leave mainstream medicine and just focus on doing the things the way I wanted to do them. And that was like a COVID epiphany.
Well, it's sometimes with that dance, the powers that be put up a lot of resistance. I'm just curious, as you were doing that and dealing with residents and students, medical students, were they gravitating to that message a little bit more easily? Because I know they're usually so excited to finally get the idea that they could actually help people get well, rather than just kind of be caretakers of chronic disease and disease care versus really true healthcare. So did you see that? Did you see some evolution of that whole movement of the students being more excited about the exposure to this?
Yes, absolutely. And that's what gives me hope for the future. It's definitely going to take decades to see this whole
Oh yeah,
culture
there's no
shift.
question. Yeah.
But the medical students, especially, were so receptive to learn about plant-based nutrition. And there's a first and second year Brown medical student elective called Food and Health, that it's a joint program between Johnson & Wales Culinary Nutrition Program and Brown Medical School. And I teach a course in that still. So I'm involved with planning that. And they always have no, everybody can't get in. It's super popular. They learn how to cook and they learn a little bit about culinary medicine. And I do a lecture on reversal of cardiac disease and what is a whole food plant-based diet and the data.
I'm here with Dr. Sandra Musial, who is the founder of Plant Docs, which we're going to get into in the next segment. We're going to take just a few moments here to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the Health Science Podcast Show. I want to remind you to visit the National Health Association website, where you'll find incredible resources to support your healthy lifestyle, including plant-exclusive eating without added salt, oil, and sugar. Simply go to healthscience.org or nationalhealthassociation.org. Be sure to check out membership, which is only $35 per year for those living within the United States and $55 for those living outside the U.S. You'll be amazed at all the information and benefits you'll receive. As a member, you're kept up to date on the latest evidence-based tools for health promotion. You'll receive the incomparable quarterly magazine, Health Science, a beautiful 40-page advertising-free publication mailed to your home or offices, loaded with articles, recipes, inspirational stories, and interviews with world leaders in the fields of personal health, plant-based nutrition, water-only fasting, animal rights, and environmental support. And you'll receive details about life-changing events, such as the extraordinary annual conference of the National Health Association and diverse opportunities for plant-exclusive NHA cruises and travel vacations to exotic destinations around the globe. I'm your host, Dr. Frank Sabatino, and now back to the show. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Dr. Sandra Musial, who was the founder of something called Plant Docs, which we're going to get into in a little bit. I noticed that you're also a culinary coach from the Harvard Chefs Coaching Program. Who knew? Who knew that even existed? Tell me about that.
So after I left my job, I wanted to try to do whatever I could to kind of beef up my credibility, to be out on my own. And this was one of the courses I took through Harvard. Everything was remote because it was still during COVID. But it was a lot of education on culinary medicine and how to teach people how to cook, which was the next step that I really wanted to include in what I was doing with Plant Docs. And it really, it gave me the confidence to start a monthly cooking class and to have more cooking as part of our education.
So you enjoy getting in the kitchen and cooking. You enjoy food prep.
Yeah, I love it.
Me too. I love it too. It's great. We'll talk about Plant Docs because I want to get into your Jumpstart program, but you brought up the cooking component. And what I loved about that, years ago, I wrote an ebook on eating out in the real world where I said, we don't need to reinvent the wheel. There's cultural traditions that have been using plant-based cuisine and preparation for centuries. So why reinvent the wheel? Why not take advantage of this incredible experience of these different cultures? And I noticed in your monthly cooking program, you've done just that. You've gotten into the Blue Zone cultures and you've actually created recipes and cooking presentations centered around all of those individual cultures, which I thought was just absolutely brilliant. So tell me about how that evolved and how that goes and how well accepted is that with the people that you work with?
Yeah, thank you. So the first year I did a full year monthly cooking class and I used Dr. Greger's How Not to Die cookbook.
Right.
And all the recipes came from that. But then this past year, I thought it would be, they were looking for the people who was cooking with me were looking for more diversity and flavors. And so we decided to go with this plant-based global cuisine. And I've always been fascinated and a huge fan of Dan Buettner and the Blue Zones.
All right.
So I really wanted to incorporate those two.
Sandra, before you go on, because some of the audience may not be aware, just explain Blue Zone cultures to people. Just give them a little intro so they know where we're going right now.
Sure. So the Blue Zones are areas of the world where the greatest number of people live to be over 100. And Dan Buettner and his team from National Geographic went around to these different Blue Zones and studied them to see what are the longevity secrets about all these different regions of the world. And one thing that they all have in common is they tend to be geographically isolated. So they're harder to get to, and then the kind of bad influence from Western standard American diet and Kentucky Fried Chicken and McDonald's hasn't infiltrated it. There's less processed food, less junk food. They tend to eat mostly plants, some of them all plants. And they have a very different lifestyle. There's less stress, a more relaxed way of living, and a lot of exercise is just built into the daily routine because they're gardeners, they walk or bike everywhere. And I think there's a lot to learn from studying the Blue Zones. So I've just been following along since Dan Buettner's been studying them. And I thought, oh, what fun it would be since we're going to do global, different cuisines. Let's incorporate the Blue Zones into the cooking classes.
Yeah, so those cultures, of course, like Okinawa, the Icarians off the coast of Greece, the Sardinians, the Nicoya Peninsula near Costa Rica. So give people a little flavor of what the kind of things are that you present in that program, because they're amazing. They're just amazing dishes. And I was just so excited to even see that. So talk a little bit about those dishes.
Sure. So when we traveled remotely, virtually to Okinawa, a lot of people had been asking me to how to make sushi. And although that isn't actually something I think that's eaten there, they eat a lot of Japanese sweet potatoes.
Right.
So I incorporated these Japanese sweet potatoes into this recipe and taught how to make different recipes from that area, including sushi. Um, and then, like when we talked about Ikaria, Greece, one thing that's really prevalent in their cuisine is all the herbs that grow wild, including something called purslane, which is perceived as a weed. Here, it grows all around my yard. It's a succulent. It's a little tiny
Mhm.
branches with little round leaves, and it's delicious. It has a little lemon flavor. You can just eat it raw in salads, and it has an incredible level of omega-3 fatty acid. And spices like that are grown all over Ikaria, Greece, and incorporated into their cuisine on a regular basis. So like in the classes, we talk about what are the foods that are commonly eaten, how do they eat, and how are they eaten, and what are the some customs, social customs that are unique to the areas. Like in Okinawa, a lot of the women gather in the afternoon and enjoy sake together, gossiping. But that social connectivity,
Oh, that's so amazing, you know.
yeah, is so important.
When I grew up in New York City way back in the day, at the end of the day, I always tell people, the parents and grandparents would be down with their folding chairs in front of the stoops, in front of the building, sitting in circles, just sharing the stuff of the day. So it was almost kind of innate, even in New York. This is in New York City. So it's such a strong suit of personal interaction and social interaction. It's such a big part of wellness and well-being. So it's intriguing that these ancient cultures have that, but I saw it growing up, even in like the city in New York, where people would come together that way. So it's kind of pretty much kind of amazing. And the other thing you brought up, I think, is important. I think too often in a lot of American cooking, we don't take advantage of the herbs and spices to the extent that we really should be. The level of antioxidants, phytonutrients, all of those things in those foods is something we just are not, brought up dealing with as much as we should. So I'm so happy that you're really sharing that incredible information with people. And I gather in that program, people can cook along with you. They can actually cook at home, right? And do this very practically.
Yeah, we send the recipe out and everyone gets the ingredients, and we all just talk together as we're cooking. So people will ask questions and say, "Hey, does this look right?" Or "Am I cutting this right?" And so it's fun, and I'm building a community of people that are cooking together and enjoying this food together.
That's fantastic. I gather that, let me go a step further. So let's go into how the whole mechanism evolved from your private practice and the problems you had with traditional conventional medicine, and what urged you to start Plant Docs, and where that then became what it is today. So let's segue into all of that, because that's such a
Yeah.
brilliant program, especially your Jumpstart programs. And I want to really spend time with that.
Well, I think what energized me the most was after I read the China study, I gave the book to my brothers, my sister, my father-in-law, my father. Like that's what everyone does, right? When you read it, you're like, everyone should know this.
Right.
And my brother was 50 pounds overweight, high cholesterol, high blood pressure. His neighbor just died of a heart attack. And I gave it to him at a time. He was a meat and potato guy. He was just ready to do something. And I didn't really know that. I just sent it to everyone. But he read the book and has been whole food plant-based ever since. He dropped his cholesterol, blood pressure, lost 50 pounds. And I saw and he's been amazing ever since. So that made a big impact on me. I saw I changed someone's life. Maybe I saved his life. How can I do this more? So that's what really, and so I started just reading more and more about it, like how Rip Esselstyn did it at the firehouse in
Right.
Austin, Texas, and how Nelson Campbell was doing these jump starts. And so when I met Kim Anderson, she had met Nelson Campbell and had done a jump start in Providence years ago and shared the data with me and said, "Hey, I'm opening this plant-based food hall in Providence, Rhode Island. What do you think? About doing this? So she gave me this idea and the courage and the confidence to start Plant Docs. I recruited a couple other doctors, and on the day Plant City opened, we started enrolling in this, our first Jumpstart, which was a month-long program where we educated everyone on the power of plant-based foods to heal, how to do it, how to read labels, how to meal plan. And
So you did it live at first. It was a live program first.
it was all live, and every
Right.
program, we had Food for Life instructors. So we used the Neil Barnard videos and
Right.
some of that curriculum with the Food for Life instructors initially. And then we did food demonstrations, and then we would all eat together.
Right.
And then we drew the blood before and after, looking for lipids and diabetes measurements, inflammation, fatty liver disease.
Right.
And after our first month, the results were so amazing. The three of us were hooked, and we were
Right.
like, this is, how can I keep doing this? So it was all like a side gig for all three of us. But I was really drawn to this. This is a true passion project. I feel like it's my life's work, that I'm meant to be doing this. So during COVID, that was rough for a lot of physicians, especially when you're hospital-based,
Yeah.
in the basement, on the computer. There were just all things about it. I just were not in sync with how I wanted to live my life. And I decided, that's it. I'm quitting my job, and I'm going to just devote the rest of my life to Plant Docs. So that was 2 summers ago, and I've just been growing it since then.
I'm here with Dr. Sandra Musial. Sandra, tell people where they can find you to get more information about Plant Docs and maybe become part of this brilliant program. What's the URL that they can go to?
Sure. The website is www.plantdocspbd.com. The PBD stands for Providence.
Right. Okay. Is that where you grew up? Were you a New England girl growing up there too?
I'm a New England girl. I grew
Yeah.
up in
Okay.
Massachusetts. Yeah.
Yeah, that's cool. All right. And so in this component of the Plant Doc program, the Jumpstart program, it's now morphed into being, I see, partially live, but really online. So you can do it any number of ways. And I know you do everything you just said. There's cooking demos, reading labels, shopping information, general plant-based information on, reversing major chronic diseases. I saw that. Yeah. So when people do that now, I know you have a couple of those coming up, one in September and then one in November. So talk about those dates and what people do to kind of connect to you and how they can sign up for that kind of thing.
Yeah, great. The first one starts the day after Labor Day, so it's September 5th, but then the next 3 classes are the following 3 Mondays. They're 6 to 7:30, so each class is 90 minutes. They can be done fully remote, so from anywhere in the country. I take half the participants on Zoom and half can be live if they're local. The first and the last class are completely educational, and the middle 2 are where we cook together. Everyone is remote. So we send the ingredients and we make a breakfast, a lunch, and a dinner.
So people send you in online pre and post blood work, or how does that work? Because I know
Yeah.
you're doing that.
I send them an order
I see.
and they go get it done, and it gets faxed to me from the lab.
Wow, that's amazing. So I noticed that it's 4 separate sessions within the month, and they're like an hour and a half each, is what I gathered from what I saw.
Right.
And you have one coming up starting in September, and then one in November. Is that what you tend to do every other month? You tend to set it in motion?
It's more like 4 to 6 times a year. People are really interested after the new year. So like in January and the spring, people don't want to do it as much over the summer. So we take a little pause and we start up again in the fall.
Okay. Yeah, so that's amazing. So have you been keeping data? You keep that data then, or on those blood parameters and that kind of thing?
Yes, I've been keeping the data, and it's just been accepted by the American College of Lifestyle Medicine. I'm going to present a poster on it at the national conference in
that's
October.
fantastic. That's really amazing. Now, I noticed within the context of Plant Docs, there is a third wing of your program that is a cancer support group. Talk to me a little bit about that and how that becomes part of what you do.
So a local breast cancer resource foundation called Gloria Gemma approached me and asked me to create a 6-week course for their breast cancer survivors. And that was a couple years ago. It was right after I quit my job, and I was like, all right, I'm all in. I'm going to research this and create this program. And it was so satisfying, and it was knowledge they weren't getting anywhere else, that this is important. And cancer survivors and people who are going through a cancer diagnosis need to have access to this information. So I created a 4-week fully remote online program so people can join from anywhere over the country that want to learn about the foods that have the most powerful anti-cancer effects and how to cook with them. So there's like a short little informational thing. And then, like my other cooking together classes, I send the ingredients and then we all cook together, and they can ask questions and learn to cook with these anti-cancer foods.
And we know most of it, a lot of it is all about the food, but there's several other major pillars of lifestyle medicine. Do you touch on those in your program, like physical activity, stress response management? Do you deal with any of those components, or is it really just, I know there's a lot going on with just food alone, but is it just food centered, or do you touch on those other pillars?
When I do my private one-on-one consultations, I touch on all of them.
I see.
I usually start a lot of the classes with a breathing technique, the Andrew Wheel 4-7-8 breathing.
Right.
I teach that. It's so simple. It takes less than a minute. And I think it's so valuable that I try to throw that in.
And
but you're right. Sleeping, it's also important.
So in terms of your private work, this is really your major focus now? Do you still do private care? Not really. No.
Nope. I quit my job 2 years ago. All I'm doing is the private consultations, running these group programs, teaching the health and food class.
And your partners, are they doing it the same way, or do they maintain any private practice?
No, they're working in private practice.
Okay, so they have their other stuff that they do too. So again, I'm sorry, I didn't mean to interrupt.
I was going to say, I'm also, have been energized since the poster got accepted.
Oh yeah, that's a big
published
piece.
the data that I'm looking down that path of, maybe doing some more research projects. Since I already have this intervention program in place, we're talking about starting a chronic migraine study where we'll enroll migraine patients, and the intervention group will get the whole food plant-based intervention, and we'll see how it can affect the severity and frequency of their headaches.
Do you do any more live stuff with Plant City and Kim at all, or is that in the past?
Yeah, no, the first and the last class of all the Jumpstarts are at Plant City.
Oh, that's where they are? Oh, that's amazing. Oh, I didn't even know that.
And my office is there too. So I do my private consultations that are in person are all at Plant City.
Oh, that's fantastic. So where do you want this to go? Where do you see it going for you and for the organization?
Well, I just want to spread the word to as many people as possible. So I would love to see the Jumpstarts grow in number and be successful. And
do you have to cap it now? Is it capped at numbers, or do you leave it wide open?
I cap it at 20 people live and 20 people remote.
So you got 40 for every session that you do, basically.
Ideally,
wow.
Yeah.
And are you booked in advance for this? I mean, how far ahead do you get booked with this?
Yeah, people can book ahead of time, but usually most people don't sign up until like the week or two before.
Yeah, there's always, we call that impulse buys. There's a lot of impulse buys always, I think, but the fact that you've got that service is just, I mean, I just think it's brilliant. I love the fact that it is so practical and so hands-on and so in your face, because it has to be that way. People need to practically get their hands into this, It's like when I raised 5 kids, and I always tell people, if they make it or grow it, if they make it or grow it, they'll do it. And that's what usually happens. So the more you get people doing this, there's that part of us that will, get turned on, and the fire gets, lit, and we're ready to kind of jump in and do some very positive, powerful things that way. So that's fantastic.
A lot of people start the program they're not sure, most people, but by the end, I just love seeing the transformation where they're like, I've never felt this good, and I have so much more energy, and I'm sleeping so much better. And some people are, until they see the blood work, they're not convinced. And then they see their LDL drop 40 points, and then they're like, all right, I'm in.
I know the blood work is startling. I mean, it
It's
really is amazing.
yeah, it's convincing.
I've been looking at this for over 40 years, and it's just, even to this day, it's always mind-boggling to me to see how powerful the power of all of this. In terms of your own life, I mean, what have you seen for yourself? Let's talk about that personally in terms of your own energy, vitality, health patterns, all of that. How did that play for you?
I mean, for me, doing something, I mean, I've always loved medicine and I've loved every job I've ever had, but this is truly the most satisfying and rewarding job. So I'm in it for the long haul. When you do what you love, that's, I think, when you're truly the happiest and most content and healthiest.
No question about it. That's your purpose and passion, and I get that. It's such a powerful thing. When you're working with the people you do, as you know, and you've seen it, there's so many changes that are occurring physiologically, physically, on blood work, and so on. I'm assuming that a fair number of those people that come into you are on medication programs and the like. How do you interface with home care physicians that they're maybe working with? Because when you do this, they've got to cut those meds back.
Yes.
It's just imperative that they do. So how does that work professionally for you and your team?
I just tell them they need to let their doctor know they're doing this. And it's somebody with type 2 diabetes who's on insulin. They need to start checking their glucose, 3 times a day and be in touch with their doctor right away, because the impact it has on type 2 diabetes is immediate. Within the first week, people need to lower their insulin dose. But I have run into problems where the doctors haven't wanted to lower the insulin dose because, I don't know, they don't believe it. They don't think it's going to last. So instead, when the patients become hypoglycemic, they want them to add in, sugar or what, it makes no sense. And so until they see the A1C dropping,
Right.
I had this one endocrinologist that just wouldn't lower the insulin dose. But
Unfortunately, A1C is a long-term measurement, so you're putting people in kind of a jeopardy to keep them at that medicated level. It makes no sense. At least with hypertension, when you see blood pressure drop, you're almost compelled to drop the med. So it's a more clear-cut, withdrawal from those meds. But yeah, that's a bit of a tough position online because you got people at a distance and you're kind of dancing in and out of all of that. So, but look, your program is absolutely brilliant. I'm just so excited to see what you're doing. And as we wind this down, do you have any final words you'd like to share with the audience out here?
I want people to know that they have a choice. And sometimes they're not told that. So when someone has an elevated cholesterol, they're often offered statins, but they're not offered a chance to change their diet and hold off on the statins.
Right.
And same with when your A1C starts creeping up. Like, I wish I could talk to all those people and say, give this a try before starting meds, because meds isn't the only answer. And that's just like traditional medicine.
It speaks to the education, which is a disease care. It's a disease care system. It's a disease management system. And the sad commentary is that many physicians never see anyone get well because they're basically told that they can't. So they're going to have to stay on this medication for life. So the steps you're taking are so profound. I mean, just an unbelievable dance to help people become autonomous and understand the power that they have within, especially when they embrace this plant exclusive way of eating and living. Well, Sandra, I really want to thank you. My special guest, Dr. Sandra Musial, I really want to thank you for sharing your knowledge, your heart, your wisdom, and your program. And I urge people to follow and go and check out Plant Docs and see what you're doing. Take advantage of this really unique, incredible program. And the location of it, you'll see the location in our show notes. And I just want to really thank you for being here and sharing yourself with us today. And I really want to thank our guests out there, the people that are watching the show. Without you, we can't do what we do. And I want to really thank you for being part of this active, healthy community. On behalf of the National Health Association, I'm your host, Dr. Frank Sabatino. I thank you for being here, and I look forward to being with you on the next episode of the Health Science Podcast. Thank you so much, Sandra. You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science, that backs a whole food, plant exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.